Meanwhile, the antiviral drug Remdesivir cut recovery times in coronavirus patients. That is according to the full results of a trial published Friday night, 3 weeks after America's top infectious diseases expert said the study showed the medication has clear-cut benefits. Last April 29, Director General or the Director of the NIH and Dr. Anthony Fauci, who has become the U.S. government's trusted face on the coronavirus pandemic, said preliminary evidence indicated Remdesivir had a clear-cut, significant, and positive effect in diminishing the time to recovery. Take a look.
That the data shows that Remdesivir has a clear-cut, significant, positive effect in diminishing the time to recovery. This is really quite important. Highly significant. If you look at the time to recovery being shorter in the Remdesivir arm, it was 11 days compared to 15 days. And that's a p-value because what it is proven is that a drug can block this virus. And I'll give you an example in a moment of why we think, looking forward, this is very optimistic. The mortality rate trended towards being better in the sense of less deaths in the Remdesivir group. 8% versus 11% in the placebo group. Different targets. This drug happens to be blocking an enzyme that the virus uses, and that's an RNA polymerase. But there are a lot of other enzymes that the virus uses that are now going to be targets for this. This will be the standard of care. I think it's really opening the door to the fact that we now have the capability of treating, and I can guarantee you, as more people, more companies, more investigators get involved, it's going to get better and better.
Now, complete results from the research, which was carried out by U.S. government agency, the National Institute of Allergy and Infectious Diseases, were published by leading medical periodical, the New England Journal of Medicine. The United States authorized the emergency use of Remdesivir in hospitals on May 1, followed by Japan, while Europe is considering following suit. The study found that Remdesivir injected intravenously daily for 10 days accelerated the recovery of hospitalized COVID-19 patients compared to a placebo in clinical tests on just over 1,000 patients across 10 countries. The National Institutes of Health, of which the NIAID or NIAID is a part, said Friday in a statement online that investigators found Remdesivir was most beneficial for hospitalized patients with severe disease who required supplemental oxygen. But the authors of the trial wrote that the drug didn't prevent all deaths. Given high mortality despite the use of Remdesivir, it is clear the treatment with any antiviral drug alone is not likely to be sufficient, they said. About 7.1% of patients given Remdesivir in the trial group died within 14 days compared with 11.9% in the placebo group. However, the result is just below the statistical reliability threshold, meaning it could be down to chance rather than the capability of the drug.